Hey guys, welcome back to the Upper Hand. So if you're working in an outpatient setting, you're probably dealing with some stiff hands pretty frequently. So today we wanted to talk about a few different ways you could send some things home with your patients so that they can be performing a prolonged stretch at home versus just a few times during the week while they're coming to see you in clinic. So I want to talk about a few different things. Of course, you've got your regular IP tape or athletic tape. I'll take Dylan's hand here. You probably use this in the clinic in some way, shape, or form, but you can obviously have your patient kind of take that home with them and tape themselves, or especially if they have someone else helping as well. So you could get that to a good stretch, comfortable stretch. You wouldn't want to do it much more than 5 or 10 minutes at a time because you don't want to cut any circulation off or cause any more pain or swelling. That's obviously one way. You can use Coban in the exact same way, but I want to show you a few tips today that we've been using in our clinics for some time now that is a lot easier than that taping method I just showed you. So not everyone has these in their clinic. This is X-Band. We call it Fingerstockinette, and it helps with reducing edema in the fingers. But you can cut this down, send this with your patients, and so how you would put this on is have them dig their finger into about the middle of that and just pull that over onto the back or the dorsal side of your P1 area here, and then obviously you got this on the distal phalanx or the P3 area there, and then you've got an IP flexion stretch. Prolonged because you can leave it on there as long as you want to, but again, I wouldn't do that much more than 10 minutes or so. Anytime they come out of this stretch after being stretched prolonged like that, make sure you tell them to come out of that extremely slowly, or that will not feel very good. All right, next you could have some type of rubber band. These are the latex, the color-coded latex bands that we get from Performance Health, and they come in different colors. We'll start with the red one here. It's a little thicker than the yellow. All you have to do is just double it, and you can slip your finger into that position. Sometimes that may be too tight. Sometimes it may not be tight enough, and if it's not tight enough, you can tie a little knot in it. I'll show you with our yellow one here. So just kind of take the top of that, or one end of that, tie a little knot, and then you can do the exact same thing. Double that up and put that around that finger, and again you have a good IP flexion stretch. Okay, last one that we like to use is with a buddy strap. This is one I haven't seen a lot of people do this, so this will be a good one for you to add to your clinic if you haven't already. Obviously, buddy straps are good for active assistive range of motion, putting it to the next finger like that. So of course they can be used in that way, but if you want to use it for a prolonged passive IP flexion stretch, we're going to put it all the way down to the P1 area of the finger, right around the proximal phalanx. You're looking at this little foam side here. You'll have them either bend their finger or have someone else help them get in that position, and you're going to pull that strap all the way around, and it velcros. So this one's cool because it's adjustable. So say that's too tight on them, all they have to do is loosen that up a little bit. Say they're in there for 5 minutes and it's no longer a stretch, they loosen it up, or unstrap it and pull it tighter. So very quick and easy for your patient to be able to do at home, so that they can help improve their motion versus
waiting for therapy only.
Yeah. So where can I start back? Very easy.
Very quick and easy, yeah.
So very quick and easy thing that your patients can do at home, so that they can improve their motion at home versus waiting to come to therapy every time. I will say this, with all of these that I showed you, you have to have a fair amount of DIP flexion to be able to get the rubber band or the finger sock or the buddy strap to kind of hold right there. So if you don't have a lot of DIP flexion, that's just going to slip off, and it's just not going to be a very good stretch for you. But otherwise, these are great techniques. Hey guys, thank you so much for taking time out of your day to watch this video. We hope you learned something today and that this was helpful to you in some way.
So you know our goal for this channel, The Upper Hand, is to give you guys the upper hand as you seek to better understand conditions of the upper extremity and just all topics related to occupational therapy in general.
So please take a second out of your day, make sure you like this video and subscribe to this channel so that you can be sure that you're going to see all of our upcoming videos. Thank you guys so much, and we'll see you next time.